Big changes are coming to Argentina's healthcare and education systems. At least that's what the government claims. Recently, President Milei announced that non-residents will no longer have free access to public healthcare and education. But is this policy about practicality, or is it simply playing to populist sentiments? Public universities in Argentina are famously free, even for international students. But to enroll, foreign students must have residency status. This means they've gone through the process of obtaining a national ID or DNI document. In other words, non-residents, the very group Milei says he's targeting, weren't benefiting from free education in the first place. So what's really changing here? Not much. This announcement feels like it's more about appearances than actual impact. Earlier this year, the government announced a budget increase for universities that didn't keep up with inflation, leaving institutions underfunded and sparking student protests and demonstrations. Now the administration claims charging foreign students will close the funding gap. But with so few non-residents in the system, how much of a difference will it actually make? What do you think? Does this feel like a genuine solution or just political posturing? Let me know in the comments. Public hospitals in Argentina have a long tradition of offering free healthcare to everyone, regardless of residency or nationality. Critics say that this has led to so-called health tourism, especially from neighbouring Bolivia and Paraguay. There's a widespread belief, which may or may not be true, that pregnant women from Bolivia cross the border to give birth in Argentina, taking advantage of free, high-quality healthcare, and with the added bonus of Argentine citizenship for their babies. Is this really true? Maybe, but there's little hard evidence. This policy change might not affect foreigners from wealthier countries so much. Take me, for example. I rely on private healthcare, as do most expats I know. Two of my American friends visit Buenos Aires every year to get their annual medical checkups. They tell me that private medical care in Argentina is much cheaper and on the whole much better quality than in the United States. But for the poor and undocumented migrants living in the shanty towns around Argentine cities, this policy is a direct hit. They're the ones who are most dependent on free public services. The provinces near Bolivia, like Salta, have already started charging foreigners for healthcare. Results have been mixed. The extra revenue hasn't solved funding issues, and local healthcare systems still struggle under the weight of broader economic problems. So why is the government doing this? It could be about addressing economic realities, but it also feels like a populist strategy. Argentina is in an economic crisis and real reforms take time. Policies like this send a message, we're taking action. But are they? Or are they just shifting attention away from more complex problems like inflation and underfunded systems? There's also an uncomfortable undertone here. The rhetoric around these changes taps into prejudices against migrants, especially those from poor and neighbouring countries. It paints them as a drain on resources, despite evidence that they contribute to the economy and often work in jobs many Argentines won't take. In practical terms, these changes might not significantly alter how healthcare and education operate day to day, but symbolically they could deepen divisions and distract from more pressing issues like inflation and underfunded public services. If the government wants to fix these systems, it will need more than scapegoating to succeed. So what do you think? Are these moves a necessary step towards reform, or are they just a bit of political theatre? Let me know in the comments. And if you found this analysis interesting, don't forget to like and subscribe for more insights into what's happening in Argentina. If you want to support the channel, you can buy me a coffee in the link below, and I'll see you next time.